I'm your host, Chef AJ, and this is where I introduce you to amazing people just like you who are doing great things in the world that I think you should know about. Well, today's guest actually came as a result from another guest that was recently on the show. If you watch regularly, you might remember Dr. Rosanne Alviera, who was talking about weight loss and mentioning that she had an identical twin sister who had gained 50 pounds. And when she lost the weight, her body didn't bounce back to the way it was before she had gained the weight. And she still had some loose skin that she was dealing with and some pockets of fat. And she had some cosmetic procedures done, and everyone inquired about those procedures. And Dr. Olvera mentioned the different procedures, but not being a doctor in that field, she really wasn't skilled to talk about them at length. And many of you said, could you please bring someone on the show that can talk about the different procedures that are available to people when diet and lifestyle is not enough to get you the body that you desire. So I have brought on my personal doctor. And now, just so you know, to be clear, I have not had any plastic surgery. I am not against it. I'm just afraid of just about everything. I went to a pedodontist till I was 40, but he's going to talk about the different procedures that are available in great detail. And he is a board certified dermatologist and cosmetic surgeon that practices in the desert area where I live at Contour Dermatology. And he's wonderful. And his name is Dr. Timothy Jochen. So please welcome him to the show. Thank you so much for taking time out on your weekend to do this.
Well, it's a privilege to be here. I really am a big fan of yours and what you do. And because of what you do, I was super excited to come on because it's really a passion of mine as well. And I'm the founder and owner of Contour Dermatology in 3 locations in the desert. And early on, I founded what I call the Skinny Center. And I'm very passionate about getting people to look and feel good. It's part of our motto. And so we founded the Skinny Center here in the Valley. And the reason I founded this center was because everybody that I know has unwanted pockets of fat. I mean, this could be models, it could be bodybuilders, sports stars, and porn stars. I like to add that because we all see lots of skin with porn stars. If anybody watches, I don't. Okay, and you know, there are a lot of ramifications that go along with this, and they health. You know, health is a big reason to try to keep your body in shape, and then there's also the aspect of emotional well-being. And so I think we feel better about ourselves when we're thinner, and there's a lot of reasons for that too. So as a physician, I want to find the most effective fat and cellulite reduction techniques that are out there. And you know, in today's society, we have so many options. And if you're on Real Self or any of these websites, you know, celebrities and Insta celebrities are all out there promoting different things. And so how do you sort through all these things that they say are the next best thing? And you know, the media is really all about the next best thing. And so it gets very confusing because I was on the circuit of doing, PR stuff, and they'd always want to know, well, what's the newest thing? And newest in the medical field does not necessarily mean it's the best thing. So, you know, it's very frustrating to me because my patients will come in and they'll say, you know, doc, I just saw this on, the Today Show, or this Insta celebrity is telling me about this new treatment, and they say it's the best thing, so I want that. And so we have to do a lot of education in our office to help people really sort out what really is effective and what is not. And so, when we talk about fat reduction techniques, I mean, you're my hero. I mean, I salute you. I admire you because really there's weight loss is the best, because teaching yourself to have a healthy diet and get some exercise is really the way to go. And I try to practice this because I really believe it. And even though I do these things, I'm a busy guy. Sometimes I eat the wrong food. Sometimes I just have those cravings that I can't fight. I'm a human being, so I deserve a treat here and there. And then we have other options for fat reduction after they've come to you, Chef AJ, and they've lost their weight, and they're feeling good, but they still just have those little blobs. And so the most tried and true way is going to be liposuction. And it's also called liposculpture or liposculpting. And then we also have other non-invasive options that are available. And there's a whole variety, and this industry has really exploded in the last 5 to 10 years. And what's exciting is we have things that you can reduce fat by not doing surgery with either heating or cooling the fat. Because fat cells are very sensitive, and so with the fat cells, you can either freeze them and they die, or you can heat them and they die. We also have things like ultrasound, which is a heating technique, And then we have lasers that, in theory, may help to disable the fat cell, and so they get leaky and they disappear. And then we also have some new things that I think are really interesting, like the M-Sculpt. I don't know if any of your viewers have heard of this, but it's the shortcut to getting toned muscles and losing fat without going to the gym. And this is one of the ones that I've evaluated myself, and I'm not a big fan. And then we have injectables like Kybella. And Kybella is just something that we're going to talk about a little bit later. Now, I want to skip down here. So, the thing that I like to tell people is it's difficult for me to pick what people should use, but I go through a lot of research by reading articles, listening to lectures, and also bringing in the reps for these different companies that make these very expensive devices. And people should know these devices cost upwards in the hundreds of thousands of dollars. My cheapest device I had maybe was $70,000. My most expensive is in the 200. So these devices are an investment. People always say, Dr. Jochen, what kind of car do you drive? I'm like, well, I don't want to talk about that. I want to talk about my newest laser that I have, because that's where I put my money. And so I meet with the reps. And then finally, what I do is I demo these devices on myself, because if it's going to work on my patients, I want to make sure that they're not spending their money and getting no result, because these treatments are expensive. I mean, the cheapest one that I know of is probably in the 700 range per treatment. So, and they go upwards of $10,000, $20,000 if you're going to do multiple areas. So it's really important to understand what works and to, it's my reputation on the line. I know doctors, they'll buy everything just because they want to be the first in their area to have this new device, or they want to have this device because, it was just shown on whatever the show of the moment is, Ellen or whatever. And, I'm really kind of a slow to adapt. I have to really make sure that the devices are working. So in our practice, I'm going to tell you my picks, and we'll go over why as we go through it. But I like liposuction because it's tried and true. This is a treatment that works. You get great results. It's minimal downtime. It's terrific. To me, it's still the gold standard. Now, we do have people that are nervous about doing surgery. So we talk about non-invasive treatments. And I have tried all of them. And the only one that I found that's super effective is going to be CoolSculpting. I like that's in terms of devices. Now, we also have injectables, and I've adapted Kybella, which is an injectable. We'll talk about that a little bit. And then we also have different things for treating cellulite, because cellulite, 80% of women over the age of 18 have cellulite. So this is something that I've invested time and money into doing effective treatments for. So one of the things I like to say, first of all, is, not everybody's a great candidate for these treatments. Very few people are not, but certain people are not. And I think my number one that I struggle with is a person that wants to use it as a weight loss technique. And they don't want to listen to you, Chef AJ, telling them how they can live a healthier lifestyle and get a little exercise and be a better person. They want to just do this as a weight loss alternative. And I can tell you this fails because unless you adapt a healthy lifestyle, you continue on that upward trend of weight gain. And so, if you gain weight after you've done these treatments, it's just really canceling out your treatment. The other thing that's a challenge for me, and I understand this one because I suffer from this in just a little minuscule way, and that's body dysmorphia. And the way I can identify a body dysmorphic person is that they start pointing out something and they keep telling me that they can see it, and I'm like, I can't see it. And they, if I can't see it and they keep insisting it's there, I know we have a problem. The other thing is I have not very many. I mean, most people are pretty savvy now, but you do meet those people that have unrealistic expectations. So, the people that come in and they're like, they ask me, Doc, am I going to have a six pack? They're 75 years old. They've never been to the gym. Their BMI is like 25. So are they going to have the six pack? Absolutely not. They haven't done the work. So no. And then finally, people who have a really high BMI who are obese. Because usually there's issues regarding food if you're obese. And so there's a lot more to it than just having a treatment done. Maybe they need bariatric. They certainly need to watch you, Chef AJ, and learn your tricks. But oftentimes there's psychological components to it as well. So I want to start out by talking about the technique that's my favorite, tried and true liposuction. I learned Yes, go
Doctor,
ahead.
I don't want to interrupt you because you're doing such
Please
a good
do.
job. But when I watch this chat box, it goes very quickly. And there is, I think, an important
Sure.
question that people are wondering about, not about the treatments. But Susan asks, what kind of training is required for performing these treatments? And how do we know if a doctor is qualified? I ask because my eye doctor offers body sculpting now and more. And I remember once when liposuction first came out, I was going to a doctor who was a gynecologist, and he said, oh, I just took a weekend course and now I can do liposuction. So before you get into the procedures, not everybody here will be able to come to you in the desert. How can they find somebody as qualified as you, so they're not just going to somebody that maybe took a weekend course?
That's a really good question. And this is a very difficult thing for people, honestly, because most of this stuff has been developed post-residency. So, you always want to look for somebody who's board certified. And I say there are 4 pillars to the cosmetic world, because Chef AJ, you had asked me that question: who's qualified to do this stuff? And a lot of people think, oh, plastic surgery, and plastic surgeons are brilliant at marketing themselves as the only people that should do cosmetic surgery. But in reality, there's four specialties, subspecialties, that have contributed to the field of cosmetic surgery. And the first one I'm going to talk about is dermatology, because I'm a board certified dermatologist. And we've contributed things like liposuction. Liposuction was actually the technique, the tumescent technique was developed by a dermatologist named Jeffrey Klein out of Orange County. And so everyone follows this technique, no matter whether you're a dermatologist, whether you're a plastic surgeon, whether you're ENT, OBGYN, whatever. So we've contributed that, hair loss, fillers, lasers, let's see what else, vein treatments. And so we have very extensive research that we've done. In fact, with most devices, you'll see that the majority of the research has been done by dermatologists for these non-invasive treatments. Then we have oculoplastic surgery, and these physicians have contributed greatly to surgeries around the eyes, and that's their specialty. So they've really done a lot of research on that. Then we have ENT, and a lot of people don't know ear, nose, and throat doctors. Also, just they work exclusively on the face. So they've contributed greatly to areas like ear surgeries, nose surgeries, and also facelifts. And then finally, we have plastic surgeons. And a lot of people think that plastic surgeons have some sort of magic. They're like, Doc, I want you to close my cancer site because by a plastic surgeon, because they're plastic surgeons and I won't have a scar. Well, in reality, that's not the case at all. I mean, they're excellent at what they do, but a plastic surgeon, if they want to be a good cosmetic surgeon, actually have to do additional training to do that. And I think they do a great job. But what you really want to do with these new devices that we have, because you don't learn to do them in your training, you have to really ask them, how many cases have you done? And I want to see before and afters that are not company, that are not given to you by the company, but your own personal cases. And I also say word of mouth is a big thing. If your friends have done something, or your family, but it's really before and afters and talking to the patients and how many have you done. So anytime I start something new, like if I try a new box or something like that, a new device, I'm like, you're going to be one of our first patients doing this. So, it's up to you to decide. But when I'm the first, usually everybody else is the first, because I've done this for a long time.
Nice. Thank you for answering
Of
that.
course. No, thank you for asking. Let's see. Okay, so with liposuction, this has a long history. It's been around since the 80s. And like I said, the technique was invented by a dermatologist out of Orange County and named Jeffrey Klein. And so what's great about this treatment is it's very safe under the hands of a dermatologist. I don't believe there have been any reported cases of death. Now, this is a big deal. If you go to the operating room, there have been plenty of cases of death. But when you're doing it with smaller areas, with the local anesthesia, no cases of death. It's very effective. By this, I mean, you'll wake up the next morning and your fat is gone. And guess what? It's long lasting because it's gone forever. And when we talk about risks associated with this procedure, there really aren't a whole lot. The worst thing that I see is that some people will have a little bit of divoting here or there, but we have other non-invasive treatments to help smooth that out. And so I really think that this is one of my favorite techniques. And if you want, I can go over some frequently asked questions, Chef AJ, I'll leave this up to you, or would you rather have me move on to some of the other treatments?
I mean, you please feel free to go in as much depth as you want. You know, like you mentioned, it's not a substitute for diet and lifestyle. I've known some people, and I've worked with some celebrities when I worked in LA, and they kept using that instead of going on a diet, and it would work temporarily, but then they would gain weight back in different places and then have to have it done. And it doesn't seem like a very healthy thing to keep doing repetitively to your body.
Right. Well, I want to take a step back. And the thing about, it went to another area. That really isn't true, because when you remove fat cells, you have a certain number of fat cells, and once you remove them, they're gone forever. Now, what you're talking about is they probably have more fat cells now on their arms, and so when they gain weight, where they would have gained it here, they gain it here. If you maintain a stable weight, though, the fat doesn't just go somewhere else. Because a lot of people think, well, if you take it off here, it's just going to migrate. And it doesn't. The fat will grow, because fat cells are elastic, and we have the same number of fat cells throughout our life. And the reason we get bigger is those fat cells expand. So when we diet, they shrink way down, and when we gain weight, they stretch out. So I think since we're talking about minimally invasive stuff, I'm going to move on, and we'll talk about some of my other things, and I can go backwards if we have more questions, or if you have more questions. So, the thing that I'm super excited about in the non-invasive world is CoolSculpting. And this has been a rocket ship in my practice. I mean, this is wildly popular. This one is great because it is completely non-invasive. What we do is we attach a subtle suction to our skin. It sucks up the tissue, and then it starts to freeze it. And what that does is the fat cells are more sensitive to cold than the skin cells. So we can kill those fat cells without damaging our surface skin cells, which I think is remarkable. And I was like, forget it. People were telling me this device is coming out, and I was like, whatever, you have to really get those fat cells out with suction, tell me about it on another day, haha, you try that. And the reason I bought it was my rep kept badgering me and saying, I want to show you my results. And I was like, it's really easy to fake things with weight, because what some people will do is, and I've seen it even in the liposuction world, they'll have the person lose some weight after they do the treatment and have them take some steroids, so their muscles get bigger, they've lost weight, they look like $1 million. It's like the Adele phenomenon. Adele just lost all that weight, and if she'd had one of these devices, people go, oh my God, look at how great that device works. But I'm sure it's hard work following a diet like you recommend, Chef AJ, or something like that. So he brought in his before and after pictures, and what I noticed wasn't the result, but the defects. Like, if the person didn't know how to use a device, there were gouges in people's fat, because the device worked so well, it left holes in people's skin. So what does that say? It says this device is working. It's not just relying on people losing weight after they do the treatment. So I was sold right away, and I bought a device, and I have 6 of them. And until COVID, they were running all day, every day. But what's great is it's quick treatment. It takes 30 to 60 minutes to do a treatment. So you're in and out. And the other thing that's great is every time you do this treatment, you lose 20 to 25% of your fat cells. And those fat cells are gone forever. So it's really great. Typically, it requires 2 treatments. So it's not something you have to keep coming back for. It's not like going to the gym where you have to keep going. It's 2 treatments.
Is it painful, Dr. Jochen, excuse me,
sure.
Is it a painful treatment?
That's so relative. Some people are very pain sensitive and some people are not. I have to tell you, the treatment itself is not painful whatsoever. I mean, I could do it all day long. It doesn't hurt at all. I've had this done in multiple areas. I've done my chest, I've done my abdomen, I've done my back. I need to do my inner thighs, and it's really great. However, when you do they do a gentle massage at the end, and that there is some discomfort with that. But I have to tell you, completely non-invasive, minimal pain. And what's great too is I do the treatment. I go on after that little bit of discomfort after I've had it done. I go on with my day like nothing has happened at all. So, I'll go to the gym, I'll go out to dinner, I'll go to the movies, I'll go for a bike ride, I'll go, whatever. There's no downtime at all. Zero. Imagine. And in fact, it's so good that I have some people that come back almost every month. They love it so much. I mean, we're doing, now we're looking for knees and ankles and all that stuff because it works, so you don't have to redo areas. So the next treatment that I personally use, because I'm going with my favorites, my favorites and my fan favorites, are Kybella. And Kybella is an injectable molecule. I call it an enzyme that's naturally occurring in our body. It's called deoxycholine. And what this does is helps to break down fat cells. So this enzyme or molecule is naturally occurring in our bodies. And so we just concentrate it, and what it does is it dissolves the fat. Now, with this, it takes about 3 to 6 treatments. It's completely non-invasive other than a liver injection. And I really am very, very excited about this product because a lot of people have this jowling right here in their face, and it's really hard to get rid of. I mean, sometimes a facelift will lift it up, but really if you have this puffiness here, a little bit of a pouch here, this treatment works great because it creates an inflammatory type response. And with that inflammatory response, what happens is it helps to shrink and tighten the skin as well. So I've really changed people's faces by doing this injection. Typically it's 3 to 6 treatments, and it's not cheap. It's in our practice, I think it's like $7.53. The one thing I do want to mention, the reason that if you have just a chunky chin, I really prefer doing liposuction or the CoolSculpt because this one does have downtime. You know, you have a little bit of swelling that occurs, and that's going to last about 5 to 7 days. But other than that, I think it's great. The let me see here. The next one that I've chosen to use in my practice is a device called Bella Shape. And I love this device because it goes back to the days of trying to find the holy grail to treating cellulite. And so there was this treatment called endomology where it just massages the tissue to try to make, because everyone knows what cellulite looks like, right? It's skin with little dimples in it, right? And so what those dimples are is you have fibrous bands underneath those dimples kind of holding them down. And so what happens is the fat cells kind of bulge up underneath these tents. And so the idea is that you break those fibers and so the skin becomes smooth. It's a great idea. So this device actually not only had the massage to it, but it also added heat suction to help break up those fibers. And the great part about this is when you add the heat and the suction and all this together, not only does it help break up cellulite, but it helps to melt some fat cells, and it also helps to shrink and tighten the skin. So this is one of my personal obsessions. Like if somebody has my guilty pleasure, it's coming in on the weekends, every weekend to get Bella Shape to tighten up my body. And it's fantastic. If you do a series of 6, I'm telling you, you'll be addicted. You won't want to do anything else with your day. I mean, it feels kind of good. And you know, a lot of people want to know what areas can be treated with any of these devices. And it's basically any area where you have pockets of fat. I mean, it could be your arms, it could be your knees, it could be your abdomen, it could be your neck, it could be anywhere. And let's see. The one that I think is kind of fun that's out there right now, this is getting a lot of buzz, is the M-Sculpt. These are those electromagnetic devices that in theory build your muscle and reduce fat. And I think everybody should experience it just once. It's like going to Disneyland. They apply these probes to your skin, and then you just lay there, and it causes these spastic contractions in your muscles. And they do it on your butt or on your stomach or wherever you want to treat. But it's kind of an experience to have your muscles go into spasm. It's like getting a Charlie horse without the severe pain. Now, I love the idea because, you know, there's a lot of lazy people who have tried all these different treatments to, you know, get rid of fat. Like, do you remember that vibrator that was like a belt that went around your belly and it just shook you and things like that? Well, this is sort of like that to me, but I do think it actually may work because you are stimulating the muscle to contract. And, you know, in their advertisements, they say that this works just the same way it works when you're going to the gym because it's tightening the muscle. But I'm not sure electrically stimulating the muscle is the same as going to the gym. In fact, I'm pretty sure it's not. But in theory, it's a nice idea. And what's great is it's only a 30-minute treatment, and you need 6 to 10 treatments with maintenance every month or so. It's expensive. This treatment is $750 a treatment. So, I mean, to me, when I look at the economics and the reality of this, I don't see how 30-minute treatment, when they're saying it's similar to going to the gym, nobody I know that goes to the gym 4 times has permanent muscle tone. I mean, does that make any sense to anybody? Yeah. You know, and so in theory, I think it's great. I mean, in fact, if it were an affordable treatment where it was similar to having a personal trainer, where it was $125 a session or something like that, I'd be all on board. I'd say, yeah, come in 4 times a week. We'll tone your muscles. We'll keep them toned, and this is a great treatment. But at $750 to $1,000 every time you come into my office for this treatment, it just really doesn't make sense to me. So I'm not a believer yet And my reps have been very aggressive trying to get me to buy this. And I'm really wanting to be on board. We just have to come up with a more economical way to do this, and also find a way where we have more research involved in it. Now, as I mentioned, we talked about cellulite. And so this device will work great for cellulite and smoothing the skin. So with the Bella shape, I'm going back, I'm sorry, I just skipped. What I was trying to say was with the Bella, what I'll do is I'll combine that Bella device back with my liposuction patients or my CoolSculpt patients to shrink and tighten the skin and smooth it out after I've done any of the other treatments that I have. So now, since I've gone over what my favorites are, why don't I just sort of mention some of the other ones that are out there, if that's okay? And let me just put on my glasses here for 1 second. Okay, here we go. So we're going to start out by talking about Sculpture. And Sculpture is a laser non-invasive treatment. And what the laser does is it uses heat. So they attach a laser probes to your abdomen, and then they turn them on. And the idea is that instead of freezing the fat cells to destroy them, we use heat to destroy the fat cells. And there are different ways we can do this, and we'll talk about the Liposuction and some of the others. But when I've tried this device, it's uncomfortable because they have to heat it to a much higher temperature than I'm comfortable with having on my body. And so this one I find painful. And quite honestly, it's a quick treatment. It's 25 minutes. It requires about 2 treatments, and it's supposed to be between $1,400 and $1,500, which is a pretty good price point. However, when I've done this treatment and my staff, multiple members of my staff have done it, we've seen no difference whatsoever. So I need something that's going to deliver a result in order for me to feel comfortable charging you $1,500 for a treatment. The next thing is liposonics. And this is another way to heat. And instead of using a laser to heat the tissue, we use an ultrasound. And the ultrasound, in theory, again, heats the fat cells, making them go into apoptosis, which is cell death. So it's causing cell death of the fat cells. This one is about an hour treatment. And with this one, it's about $1,500 to $3,000 treatment. And again, I've tried this one, it's hot, and I didn't find it to be effective whatsoever. And when I talk about this, I think a lot of people, I feel sorry for doctors with these devices, because your rep comes in, he buys you lunch, he's a smooth talker, it's fun to spend time with them because they're attractive usually, and they're usually pretty fun. And they show you before and after pictures, and that's all you have to go on. Because a lot of times, when they come into your office, my first question is always, can I try this device out on my staff and on myself? And the response frequently will be, it's in such demand, we don't have any boxes that you can try because everybody wants it. You know, we're back ordered 2 years, so I can get it to you in your office, even though it's back ordered for 2 years, but you can't try it out. And that's a big red flag for me. But, you know, in medicine, we're led to believe in science, and that if there's scientific evidence that this works, that it's the real deal. And I don't know how, like I said, I know some of the tricks that they'll do is they'll have their people try these devices, and what they do is they have them try it, and then they give them a diet plan, and then they come back and they get their after pictures, and they don't mention in these pictures that they've lost 20 pounds in addition to having the treatment. So it's a very difficult world. So some doctors can buy into the fact that there's scientific studies, and also that they have these great miraculous before and after pictures. I say phooey to the before and afters. I want to see it on somebody I know without weight loss and see what really happens. Okay, one of the things that is popular also is, I love the idea of this one. It's a radio frequency heating device, and it sort of floats around you. So you have these panels that kind of float around your body, and it heats the fat cells and allegedly kills them without touching you and without pain. How fun is that? That's a great thing. I mean, I sign me up. But you know, if you're not even feeling the heat and it's not touching you, you know, I've never seen before and after pictures that I think are legitimate. But this treatment is about $2,200. The other one that I think is really interesting is cold lasers. I don't know if people have heard of the cold lasers. They're just a low intensity light, that they were actually developed as anti-inflammatory devices for people who are doing physical therapy. And so, everybody's looking for their box to do multiple things so that they can make money in multiple ways. And so this one is a low-level energy laser that doesn't destroy fat cells, it damages it. And so I feel like I'm watching the political debates when I hear these stories. I'm like, can anybody believe any of this stuff that anybody is saying? It's like, so the idea is it just leaks the contents out of the fat cells, and then there's skinnier fat cells, and so you're supposed to, lose weight. They call it emulsification of fat cells. And great idea because they don't hurt, there's no heat, wow, who doesn't want to lose weight that way? We wouldn't need you, Chef AJ, if this stuff really worked, right? So anyway, it's $1,500 to $300 a package, and because it doesn't work, some people are just offering it for, I've heard, as low as $395 for a whole series of treatments. But buyer beware. And then when we talk about cellulite, I actually am shocked at how few women really care about their cellulite, because I've had cellulite treatments for 15 years at least, and I thought I could run a business based on cellulite alone, like Dr. Tadoff ran a business based on tattoos alone. But it's not as interesting to me. And Chef AJ, why is that?
I don't know. I don't even really know 100% what cellulite is, because I've actually seen people that were at their ideal weight and still had it, in a bikini on basically on the sides of both of their thighs. I actually, believe it or not, and don't judge me for this, because this was for research for my weight loss book, had gone to a strip club, and it was amazing how these women had perfect, thin, beautiful bodies, but still had cellulite.
Exactly. And it's just those fibrous bands. It's the way we're built to have fibrous bands that attach perpendicularly to the skin. And so the fat just bulges up because these tethering is pulling it down. So with all the devices that we have, they're really built on trying to break those fibrous bands that are pulling the skin down and creating those pockets. And there's a laser treatment called the cellulase. And what it does is it uses this laser light to actually cut those bands. And so then it releases those fibers so that the skin can be smooth and not dimply. And their claim to fame with their device is the fact that it's a laser, so it heats the skin. And in the skin, we have these cells called fibroblasts, and the fibroblasts are actually factories for collagen elastic fibers. So if you stimulate new collagen elastic fibers, what's going to happen is you're going to have smoother, tighter skin. Now, for me, laser devices have been used to aid in the liposuction process. And when they do that, what they do is they put the laser in first. It's the laser that goes and it dissolves some of the fat, and it heats up the skin, and it helps to shrink up the skin and coagulate the blood vessels. So magically, you have less bruising, you have better results, and you have tighter skin. But if I look at it, and I'm kind of I like to think very simplistically when I think of treatments and how they work. And to me, you're taking basically a hot poker, which is the laser, and you're moving it around underneath the skin. Now, if you could move that laser continuously and have an even production of heat everywhere underneath the tissue, I can see that working. However, my hand isn't that precise to smoothly move that laser so I don't create burns underneath the skin. And I know I've seen many cases with a laser lipo where they actually have burned the underneath the layer of the skin, creating scars and divots in the skin. So I'm not really that huge of a fan of the lasers. And whenever I talk to the reps, they hear me say that, and I never see them again. So sometimes go ahead.
There is a question from Michelle. It says, can you please talk about skin tightening after somebody has an over 100-pound weight loss from diet and lifestyle modifications?
That's a great question. I love that question. And that it's so variable from person to person. And if she'd like, she can send her pictures to my website under constant contact, and we can get you that information. But it really depends on the person and the age and the duration of their weight loss, because some people may lose a lot of weight and their skin will retract. But when you're talking about 100 pounds, frequently what you'll see that the skin has been stretched. And so unfortunately, at that point where the skin has been stretched, when you lose that weight, you do have some redundant skin or some loose skin. that really the only treatment for that amount of excess skin is surgical excision. And that would include arm surgeries where they do an incision on the inside of your arm. You can do a tummy tuck. They do thigh tucks where they make the incision on the inside of the thigh. And with this, what I would do is call a local bariatric surgeon in your area. Not saying you did that, but they know the people that are really good at removing the skin. And what's great is frequently the physicians that do this can get it covered by your insurance if it's causing you any difficulty. First of all, there's psychological difficulty that you can have from the treatment, or secondly, you can have infections like fungal infections or irritation underneath those skin folds. So I highly encourage consult to one of those doctors and find somebody that your bariatric doctor recommends, because you really want somebody that does body contouring for this type of situation.
Dr. Jochen, if somebody does have skin removal because they lost a considerable amount of weight and gains weight back, is there a problem then? Because the skin, does the skin just re-stretch out again the second time?
Well, that's a very good question. And typically what I see is it's usually more bariatric type people that are going to have that problem. Or bariatric people are not going to have that problem, because after they've done the surgery, it's much more difficult for them to gain that kind of weight again. In fact, I've never seen it happen. Somebody who just loses that kind of weight loss, typically, I don't do that surgery, but I would guess there are psychologists out there that will counsel you to make sure that you're not going to run into that situation again where you're going to gain that weight. But I'm speaking out of my area of expertise, so I really don't have a great answer for that question.
And people want to know about bat wings. Which are the procedures you recommend for bat wings?
Oh, bat wings. Bat wings is one of my favorite things. Again, this is really a situation where it depends on the person. If you're a young person who doesn't have excess, huge amounts of fat, we can either do liposuction or CoolSculpt. And my patients really love this treatment. However, if it's really very loose, and let's say you're past the age of about 55, because as we get older, our elastic fibers tend to wear out a little bit. And so your skin isn't going to retract quite as well. So, again, you really need a consultation with somebody to ask them if non-invasive treatments are going to be effective or liposuction. But if the elastic fibers are shot, you're going to have to do the surgery where you do the incision right along here, and then it's hidden in this area here on the inside of your arm.
Is it, Diana's saying, do those surgeries leave scars?
Yes, they do. Absolutely. Any of those, and that's a lot of people's hesitation when they come to see me. They'll take the risk of having a little bit of excess skin because they don't want to have the scars. Now, remember with scars, they always get better over time. But, it just depends on, if you're willing to have a scar or not. But when you talk to your doctor who does these procedures, always say, can I see pictures of the scars? So that way you can determine whether that risk outweighs, or the risk of the scar outweighs the benefit of being able to wear, short sleeves again. So that is a situation. And I may be able to find here one of my arm pictures.
Great. And I have a few more questions people actually sent in, knowing you were going to be on the show, from Heidi.
Sure, I'd love to.
The freezing the fat treatments, how does it affect the skin? Can you get frostbite from it?
No, you cannot. With that, it's temperature regulated, so we're monitoring the temperature on the skin to make sure it doesn't it's not cold enough that it's going to damage the surface of the skin. And as I mentioned earlier, the fat cells are much more sensitive to temperature than the skin cells. So that's never been an issue. Now, there are counterfeit devices that they sell that are not CoolSculpt. So you really want to invest in going to somebody that has the CoolSculpt brand, because the other devices really are not as regulated and they don't have as much history with treatments. So I'd say definitely use the CoolSculpt.
That's a good point, because not all machines are the same, because Janet has written that in this, I don't know if she means with the CoolSculpting or a different brand, but she said she's heard reports of problems with it. Some have gained an unsightly block of fat in another area of their abdomen after treatment. How does that happen and how do you avoid it?
Well, in an area that was untreated, I can't imagine how that could happen. I would question the validity of that person's complaint. because there must be something else going on, or they must not be getting the traditional treatments for fat reduction like CoolSculpt. Now, there is a rare phenomenon that can happen with CoolSculpt, and that's where you get idiopathic lipohypertrophy, fancy medical word for saying that when you try to freeze it, the fat gets a bit bigger. And it's less than 1%. I've seen it a couple times in my practices. It's very, very, very unusual. And for anybody who has that happen, what we do is we just do traditional liposuction, and that takes care of any of that. But I hate to even mention it because it's such a rare phenomena that it's so unlikely to occur in anybody that gets this treatment. Oh, here we go. Okay. Any other questions?
Yeah, I'd love to see some of the before and after pictures of some of your work.
Okay, sure. Now, here is a arm right here.
Wait, you're not connected yet.
Oh, I'm sorry. Yeah. Let me see if I can get this. I'm not really great with this share screen thing.
That's okay.
So let me see if I can go back to you, Chef AJ, and then back to you. I'm having a challenge here. I'm sorry.
That's okay.
There we go. Okay, so now I'm going to share screen.
I'll just answer this question from Maggie. How did you prevent having loose skin when you lost all your weight? Maggie, I've got plenty of loose skin, and believe me, I'm open to some of these procedures. I just don't maybe have it where you're seeing me, but trust me, you'll never see me in a two-piece. I always wear one of those bathing suits that's more like a skirt because I have plenty of loose skin. My butt goes like this, my thighs go like this. So yeah, and I only lost 50 pounds. So I can imagine those of you who are watching, and many people watching today have lost 120 and 140. Congratulations. So that's amazing. There you go.
Okay. So there we go, finally. So that's one of the arm treatments that we did. This is a little bit of liposuction. And then let me see what else I can find here in terms of my photos. What we have here is we have a liposuction again, and you can see this is pretty recent. So that's another one. And, I mean, my website, I have tons and tons and tons of photos. So this is just a reduction of bra fat. You can see here some of the bra fat disappeared. And I like a more natural look. She would need additional treatments to help smooth out the skin, and this is where we could use Bella Shape in order to get rid of it. Oh, here's a nice one for chin. You can see her chin. This is just from CoolSculpting right there. So it's a nice natural look to get rid of the fat underneath the skin. And then here's a little bit of CoolSculpting. See how nice, a lot of people, again, some people would be not happy with this result because they have unrealistic expectations or they want to have the six pack, but in reality, of course, they look much better in clothes, they feel better. So, let me just see here. We have, again, another chin. See how nicely that works to get rid of the fat. And that's just by doing non-invasive treatments.
Yeah, Laura says your work is beautiful. That really is a big difference that the lady's face.
That's very nice of you. And like I said, on my website, I have tons of before and after pictures. I think it's really important that you actually see what kind of work you're getting, what you're getting yourself into.
Jackie wants to know if you have any treatments for creepy skin. She says she's 56 and has cellulite and loose creepy skin. Or crepey skin. Maybe.
Yes, that is something that's a hot topic. And one of the situations the reason that's happening is because our fibroblasts, those factories that produce, excuse me, collagen and elastic fibers, break down as we get older. And you'll start to see people in their mid-20s start to lose their elastic fibers. And that's why my daughter, when she smiles, has no wrinkles. When I smile, it's a mess because my elastic fibers are no longer working. So when I smile, the skin doesn't shrink, it puckers. And it's more of a finer situation on your arms when you can see just the crepiness on the arms. What I use is Retin-A on my arms, and I also use alpha hydroxy acids. And my favorite product is called Glyto. And for those of you who are naturalists, these are basically derivatives of natural products. And so I'm a huge fan. these two products are the two that are scientifically proven to work to stimulate new collagen fibers and hopefully, in theory, more elastic fibers as well. So that's my treatment guideline: retin-A at night and alpha hydroxy acid in the daytime. So I think they work great in combination. In fact, I'm working on a product that does this very thing.
Jill wants to know, CoolSculpt versus liposuction. What is the determining factor when deciding which would be better?
It really is more of a personal decision because I think they're both very effective. Now, some things that come into play are price, because typically CoolSculpt is going to be more expensive. Number one. Number two is some people just don't want to have anything invasive done to them at all. Now, some areas like the inner thighs are going to be more of a challenge when we talk about doing liposuction, because there's a risk of contour irregularity, because the skin is typically so loose already, even in young people. If you pinch that skin, it just feels kind of doughy. I mean, on even fit people. And so in that situation, I'd recommend CoolSculpt. But it's really going to somebody that does both. Hopefully, like in my office, we offer both treatments. So that way you get a realistic, objective opinion on what's best for you. If you go to somebody that does only CoolSculpt, they're a hammer, they're going to tell you, of course, CoolSculpt all day long. So, just it's really an individual decision based on you and, what the provider thinks as well.
People are asking about infrared sauna. Does it burn off fat cells?
I think they're talking about the low-level lasers, which are just a red light. Is that the question, do you think?
I'm not sure. Somebody says that you get rid of 600. They used to work at a place with them, and you could get rid of 600 calories. I've never heard of this infrared sauna.
Oh, it's sauna. Maybe it's just a sweating thing where you can. I'm not familiar with that. I'd love to know more about it, but no, I don't know.
That would be pretty easy. Diane,
yeah.
You were talking about retinols. Diane says, can you buy these products over the counter, or are they prescription only?
The alpha hydroxy acid, I'm a big fan of Glytone. You can get it online. It's a physician dispensed product, but you can get anything online. And one of the cautions I have is when you're buying products online, don't necessarily go for the cheap product, because I know I have physician grade products, and my patients will say I can get it for half off online. And so I talk directly to the heads of these companies, and I'm like, how are people selling these products for that? And because I deserve that discount, because I'm one of the biggest seller of these products. So if I deserve the best discount because I sell so much. And they said that these are typically counterfeit products. So, I caution you about doing that, because, sometimes you can go to Mexico and I think they're really legitimate people, but also sometimes you can get counterfeit goods. And so don't try to save money on your products. Get the ones that actually work. Because, otherwise they're just fancy moisturizers. And so if you just want a moisturizer, buy CeraVe. But if you want something that's going to actually work, you're going to have to pay a little bit more money, but don't spend money.
Great. Michelle says, have you ever worked on the fat pad at the outside of the ankle bump?
Yes, I have. And it's very effective. It's a very quick treatment. To me, the only way to get that one is to do liposuction. It's about a 5-minute procedure. It's super simple. It's in and out. Very, very easy. And again, if you want, we can take a look at your pictures. So feel free to send those pictures and we can tell.
Yep. And Laura says she's heard of people having bumps after liposuction. Is there a procedure used to fix the bumps?
This is one of those situations where you really want to see a person's before and after pictures, because like I said, with those laser lipo treatments, what they're doing is they're putting a hot poker in underneath, and they're going to tell you your skin's going to be smooth and tight, and you're not going to bruise, and you're going to have better results. But what it does is it causes necrosis of areas of fat. Like that hot poker's right here. So guess what? It's creating a ball of loss of fat right here, but then you don't have it over here. So then you have a loss of fat over here. So it creates this contour irregularity. And so if it's not really severe, we can just use the device called Bella, which has heat, suction, and heat and suction, and I guess that's it, and massage. And I use that every week because I had really bad liposuction when I was young, and it's really smoothed it out. Like I was embarrassed to go outside because my liposuction was so bad. But over a series of using this treatment, I actually feel confident again. Now, if you have that happen, I mean, this is a big deal, and you have to be committed to making it right. So sometimes what I'll do in patients who have it really bad is we'll take either just fat from another area and put it in those dents first, We can do subcision where we break up the scar tissue underneath, help it lift up a little bit. We can do the velas. So it's really an individualized treatment plan based on what you have. But there are lots of options, and I've seen miracles.
Great. Diane says, do you have any recommendations for a doctor that does this in Tucson? Tucson's not far. Just drive to him. It's like 4 hours.
Exactly. Get over here. I think that there's Jody Comstock is a good starting point. She's one of the top filler injectors in the nation, and she also has a lot of non-invasive devices. I think she's a very honest, hardworking person, and I think she's terrific. So I would try her, Jody Comstock, Comstock.
Thanks. And Jean says, what about radio frequency and neck tightening?
This is an interesting situation. Now, there are different types of neck tightening, and I actually did forget one of my favorite devices, actually, and it is a radio frequency fractionated device. And what this is, it means it has prongs that are radio frequency heated. You launch it into the tissue, and it heats, and it monitors how much heat is going in. And what it does is it melts fat and shrinks and tightens the skin. So with this one, I'm a big fan. Do I think it's as good as CoolSculpt or Liposuction or Kybella? Absolutely not. But I think if you want just to tighten the jawline and get rid of just a little bit of fat, I think it's terrific. I also use it on body as well. Now, that's the one I've selected because I look at all the different types of technology and I think the one that's going to do the best job and have some sort of a result. And that's the one that I think works well. Other radio frequency devices that heat the skin, I don't think are that effective, honestly. You know, my Bella has some of those properties where it may shrink and tighten the skin a little bit. But again, send a picture, because what you need to know is are you young enough? Do you have enough elastic fibers that you can see an improvement, or are you going to have to do this? You know, it may just be, you may need a neck lift.
Yeah. If you don't mind me asking one question, not on cosmetic surgery, people need to know you're also a board certified dermatologist, and you do a lot of work with people that have skin cancer. And I'm wondering how much of it you see in the desert that maybe could have been avoided with either not being exposed to the sun so much or proper skin protection.
That is basically the bread and butter of my business. I mean, it is a huge part of my practice. And I think it's really important what you're saying is, you know, for moms, start protecting your skins at an early age. Because, you know, the damage you get as a child actually translates into the amount of sun damage you have and how many skin cancers you're going to get. So yes, wear your sunscreen, avoid direct sun exposure. You know, so I can't emphasize that enough. And I could go on and on and on about sunscreens and sun protective clothing and all those things. I do want to mention one thing that's really exciting, though, is there's actually been a drop in the incidence of melanoma in the younger age group of women. So this is very exciting because this is the first time in history that we're actually seeing a reduction in that younger age group. So people are really getting the message. So hallelujah. But remember, there is no substitute for sun protection in terms of having a youthful appearance, because the sun damages your collagen, giving you wrinkles, and it also gives you those brown blotchy spots. So sun protection is huge.
Yeah. Well, you were the one that convinced me, because before I met you, I was one of those people who in the 70s and 80s doused myself with baby oil and laid in the sun. And you read me the riot act on you actually I was referred to you by my dermatologist, and he said, no, and you scared the living crap out of me. And and not only do I don't even wear sunscreen anymore. I just wear, like, this was before COVID. I was wearing that full, you know, the hat that covers everything.
Yeah. Well, and look at how beautiful your skin looks. I mean, your skin looks beautiful and tight. And, you know, if you told me that you were a sunbather in your youth, I wouldn't believe you.
Yeah,
I don't believe you. It looks so good.
Yeah, and I'm 60. And I promise, guys, I haven't had any work done yet. And I say, yeah, because I am open to it. I'm just afraid of all the pain and the downtime. Because there is a little bit of downtime after these procedures, isn't there? Like, because I'm an avid cyclist, and I think you have to not exercise for a little bit afterwards, right?
Well, you know, this is one of those things where there's no real definitive scientific evidence for that. And so you're talking to somebody who loves to go to the gym. So when I treat my patients, I'm always like, you know, there's a period of 3 days where when your body's in the healing process, your capillaries are leaking. And so I say, you know, take it easy for 3 days. But, you know, I had a facelift and I was back in the gym the next day. I mean, I'm a big fan of exercise. I believe in circulation. I believe in, you know, just getting the heart rate up a little bit. So I'm much more liberal about prescribing exercise as therapy for healing even.
That's great. People are asking, Gail says, what sunscreen is best, zinc or mineral? And what is your recommendation then for vitamin D? Kat says, and Cheryl says, is there a safe amount of sun we can get in order to make our own vitamin D?
Oh, I love those questions. That's a very controversial topic. And it's very frustrating for dermatologists because dermatologists are a hard no. We don't do the soft no when we talk about sun exposure, we do a hard no. And I'm a realist because I live in the desert and I like outdoor activities. I golf, I bike, I dabble in tennis sometimes. But the reality is the less sun you get, the better it is for your skin. Now, when you talk about sunscreens, the best is going to be to do the zinc and titanium sunscreens. And the reason these are the best is they don't break down. There's always controversy over the ingredients of sunscreens. Right now, there's this controversy about how much of the sunscreen gets into your system. And, there's always some debate over this. We still always recommend sunscreens. And for me, zinc and titanium are the best. Now, I am a huge fan, and I'm trying to think of the name of it. It's such a great product line. Oh my gosh, I'm blanking out on it. But with the zinc and titanium, you want to get the micronized ones that are very fine particles because they can look white on your skin. So if you're a brown person, they can look purple, and on a white person, you can look ghostly. So I always recommend a little bit of tint to those sunscreens. And do you mind if I just step up my door 1 second?
Not at all. I'll talk to people for a minute because we
I want to find out what that name is.
So
Okay,
guys, while Dr. Jochen is getting his products, again, we're not recommending any of these procedures until you have tried diet and lifestyle and are left with results that are not what you were seeking. But I did want to mention that tomorrow I am starting a 21-day program called Lose Weight with a Full Plate. If you want to try a more natural approach to losing weight and lifestyle change before you consider some of these procedures. And I'll get to your questions on sunscreen as soon as Dr. Jochen comes back. If you do live in the desert, it's very hard to get an appointment with him. It's usually about a 4 to 6 month wait, just so you know.
Okay, so I'm out of breath, but I think it was worth the wait. LTMD, love it. My patient, I've never had a fan base for sunscreens, but this product line, people go crazy over. People love this. I love it. My 15-year-old daughter loves it, and she's very finicky with products. So she doesn't listen to her dad most of the time, but she loves this one.
I believe that when we had a board certified dermatologist, Dr. Krant on, she actually recommended that brand as well. A lot of my viewers are also ethical vegans, so they worry about whether the product is vegan and tested on animals, but there are websites that they can look that information up on.
And then the other question that was asked as well is, what about vitamin D, and is there a safe amount of sun? And those questions, dermatologists typically are, and me included, recommend that you get your vitamin D through supplements. So, not through sun, through supplements.
Yeah. So, yeah, because Monica says, well, what if you don't want to wear, where was your question? If you don't want to wear sunscreen at all?
I'm with you, Monica. High five to you, Monica, or fist bump. I don't know what you are. Fist bump or high five. I'm with you. I hate to wear sunscreen. I hate it, hate it, hate it. However, so my ways that I avoid it are to wear a broad brim hat, 4 inches around. And also they have really great clothing now. And the clothing brand I use is Coolie. It's really great. It's comfortable. It breathes. I don't feel like I'm going to die suffocation. However, I do use sunscreen when I'm riding my bike because I'm just not going to take that risk of getting skin cancer. My dad has metastatic melanoma, and I don't want to get the wrinkles and I don't want to get the brown spots. And so I am going to do whatever I can. But I'm with you. And I say, wear hats and protective clothing and seek shade.
Great. This is amazing. People want to know, can they order products from your website and get them shipped to them?
Absolutely. Yes, absolutely. And we do Zoom consultations if you like as well, because that's one nice thing about COVID is we've really gotten more savvy with doing Zoom consultations. So you can send in pictures, we can do a Zoom consultation. We can go over the different treatments that might be best for you, even things like sunscreen, if you have any questions about that.
That's amazing. I didn't realize. Yeah, that is so cool. You can do this by Zoom. So that's amazing.
That's great. Isn't that fun? Yeah. And because we're in Southern California, and so we get people from all over. We get people from LA, we get people from San Diego, San Francisco, we get people from Arizona. And so it's nice. I've been around long enough that I have a reputation that brings people out. So we've gotten really good at doing visits via Zoom.
Yeah, and you have a beautiful office and your staff is always so nice. I really love going there. It's very warm and welcoming. And you also are,
Okay.
you are a professor you teach this at USC, don't you?
I do. I'm celebrating my 19th year as a clinical professor at USC. And I always tell the joke, when I first started out, the kids loved me. I got teacher of the year like 4 years in a row. And now that I'm older, I don't get teacher of the year anymore. That's my sad part of that story. But it's really exciting to work with the young minds that are going to be the leaders in dermatology tomorrow. So it's an honor to do that.
That's amazing. Well, it's just been wonderful talking to you and having you describe the different procedures, because I know people really don't know which one to choose. And I think you're right. I think they should have a consultation either with you or a qualified person, either Zoom or in person, to see which one is going to be right for them, because everybody's different.
Well, thank you so much. It's been a pleasure. And I'm a huge fan, and I love what you do. So thank you for letting me be on your show.
One more question, because this comes up a lot, and I know what you're going to say is that prevention is the best thing. These are from the sun. But Reba says, what can you do about those brown spots?
Oh my gosh, that's a huge chunk of my business. For me, the Obagi line, and I'm a big, a lot of doctors are not going to give you recommendations because they speak for so many different companies. But I am a huge fan of Obagi. It's called the, what's it called? Oh my God, here I'm on camera and I forget everything. Transformation Kit. The Transformation Kit by Obagi is the best product line for your skin that ever was made. It really does transform your skin. I've been using it for 20 years myself, and there's nothing like it. But it just depends on how many brown spots you have. So we go from the product line, which is essential, and then we have different non-invasive treatments, and they include non-laser treatments like intense pulse light or photofacials, to more aggressive things like Fraxels, to CO2s, to if you just want spots, we can do tattoo lasers. So it's a very exciting time for brown spots. This is something we're very good at.
Great. Thank you so much. This has just been so wonderful, Dr. Jochen. I really appreciate your time. And I appreciate all of you guys watching. And please come back tomorrow when my guest is Chef Christina Martin, who's doing a wonderful culinary demo. Thanks again, Dr. Jochen. It was great catching up with you.
Thank you so much.
Bye-bye.